In this lecture, we will discuss laboratory procedures and make sure that you understand how to read and interpret the various parts of laboratory procedures. In the laboratory, you use procedures to help explain how to do various tests and different things that can affect the tests. There are a variety of things that are included on a procedure. So a procedure could be something that is sent from the manufacturer, or it could be something that the site itself has developed for their particular laboratory. And we often refer to these as standard operating procedures. So this is the procedure that has been established within the laboratory so that the staff or the operator or the person that's doing the test has a written set of instructions on of that particular test, and it has detailed instructions on different things throughout that procedure that it could affect how the results are reported. And so these procedures are set up to kind of give you an idea of how to perform the test correctly without any sort of interference. So most of your tests are your kits, reagents, your analyzers, your different test systems. They all come with some sort of procedure. And so those procedures should always be provided from the manufacturer. So it could be some sort of package insert, product inserts, product instructions, or it could be an operator's manual if you're dealing with an analyzer. And then you'll have a subset of procedures with an analyzer if there are particular reagents with it, and those can often be referred to instructions for use. So you may hear them referred to as in a variety of ways, but generally overall in the laboratory, once a laboratory gets any sort of kit or analyzer, then they'll have to write their own procedure, and this is referred to as a standard operating procedure for that particular laboratory. CLSI has developed standards that are considered the current best practices for clinical laboratory procedures. And what they have done is developed a list of things that should be included in every laboratory procedure. And those are title, the purpose or the principle of the test, the procedural instructions, any sort of related documents that may need to go with that, like reference ranges or anything like that. References for that particular procedure, the appendix or attachments, and of course they also need to include who wrote the procedures, and within like a hospital laboratory or physician's office laboratory, they have to have some sort of approval. So this is usually the supervisor or the director of that laboratory. Now, to take it a step further, CLIA also regulates a little bit more about those procedures as well, and those regulations state that the laboratory director has to ensure that a procedure manual is in place. And so those standards state that the director themselves has to approve that manual and make sure that it's available to all of the personnel and that they are actually following those procedures as stated. And so it outlines the minimum requirement that a laboratory must have in place regarding a laboratory procedure. And so this is the procedure manual itself. So this manual has to be something like a binder where everything is put into this manual that includes the tests or the different assays or anything that might be done by the laboratory personnel. It has to be available to the lab personnel to have access to whenever they're in the lab working. And so you can have textbooks and other things to kind of help supplement. So if you're in the lab and you're doing your analysis and you're not quite sure about a crystal, you can refer to the textbook as far as images and making sure that you're identifying that crystal correctly. However, that cannot be in place of a laboratory procedure. So there actually has to be a set of procedures that are written out for that specific laboratory. That regulation outlines what those procedures should include. And so it requires that you put in there any sort of requirement for patient preparation, sample collection, how you label that sample, you store it, you transport anything in detail. Is it a particular sample that is required for that test? So it could be serum versus plasma. If there's any sort of microscopic examination, then you need to include how to determine if that is a adequate slide or if it's not prepared properly. You need step-by-step instructions of how to perform the test, if there are any calculations that are needed to report that result, or how you interpret those results. So what's considered a positive, what's considered a negative. It includes any sort of preparation that is needed for anything that's included in that test. Your slide preparations, if you have to make up calibrators or controls, how long do those controls set out at room temperature before you use them? Are you not allowed to use those? Are you allowed to use those controls straight out of the refrigerator without warming them up? Are those controls only good for 10 minutes after you open them? So these are all things that should be included within that information. It should also include any sort of calibration or calibration verification procedures that may be for that particular instrument. If there are any, it should include the reportable ranges. So is this test only valid if the result is between 10 and 20? If it's beyond 20, what do you need to do? Do you have an additional test that has to be performed, or is it verified by a certain way? So these are all things that have to be included in that procedure. It should also include anything to do with the controls for that test. Should they be run every 8 hours? Should they be run once a shift? Are they run once per kit, once that kit is opened? And you should also include any sort of corrective action. So if control fails, what do you do next? And this may be, it could include repeating the controls, or if controls fail after repeat, then recalibrate. So all these little details should go into that procedure. If there are any limitations of that procedure, is there something that interferes? Is there a medication that if the patient's taken could interfere with that test method? Reference intervals are the normal values for that particular test. So what is considered normal for that test based on your patient population? This could also include male versus female, various age groups. What is considered a critical value or a panic result? Are there any other information that could be helpful for interpreting that test? So any kind of resources that you may refer to, any other reporting mechanisms. How do you report it in your system? What do you do if you get a panic value? How do you report those? Who do you alert? And so these are all kind of detailed as far as the system itself. If it's in an analyzer, if you need to detail if that analyzer does not work, what is your next step? What do you do? Does it send out to a reference lab? So there's usually someone who writes these procedures who is very aware of all of these details to make sure it goes into that procedure. CLIA also states that if it's something like an analyzer and you do use the manufacturer's manual for that analyzer, then you need to make sure that in some way that it is tailored to your lab. So a lot of the manufacturers will they'll develop some sort of procedure manual or an operator's manual for that machine that'll give you various things about the machine, how to clean certain things on the machine, things like that. And a lot of times within those manuals they'll have some blank spaces where the lab themselves can kind of fill in certain details about lab specific details. So in other words, if an analyzer is capable of running 50 different tests, but your particular laboratory only does 10 of those tests, so those are things that might be kind of manually edited within that procedure manual. But if a laboratory does choose to use the manufacturer's operating manual, then the laboratory themselves has to actually sign and approve that particular manual for use, and so there has to be documentation within that manual. In addition, CLIA also states retention requirements. So for anything that you might test, there are certain things that have to be retained for a set amount of time. Some things may be indefinitely, some things may be just a couple of years. And so any records that may be pertaining to that test, most things are about 2 years. There are some things that are a little bit longer, but this is also something that's going to be put in your laboratory procedure manual. Most manufacturers for your various kits and reagents and analyzers do include all of that information that's required by CLIA. However, occasionally you do have some kits that some information might be a little lacking. So it is the laboratory's responsibility to make sure that they have a procedure that includes all of those details that are required by CLIA. And so therefore most laboratories do choose to write their own procedure because they do kind of have to modify it according to their lab. For example, a kit may say that you can use plasma or serum, but this particular laboratory may only draw plasma tubes because that's primarily what they use. So those details need to be kind of spelled out in the procedure as far as what the laboratory's expectation is for their facility. If, again, the laboratory does choose to use the manufacturer's instructions, then the laboratory director would have to sign off on that, and of course that does have to be dated. And there are some other details that a laboratory director must review procedures yearly, or the designee of the laboratory director, so this is usually something like a technical consultant. And then also the laboratory needs to ensure that if they are using the manufacturer's procedure, or anytime a manufacturer, you get a new kit or anything like that, you do have to routinely review those procedures that come with those kits to make sure, or those instructions for use, to make sure that they have not updated since you last updated your policy. And if you do find that there are revisions, then you need to update your policy to match those revisions. And then any updates does need to be approved and signed by the laboratory director. And just for a little bit better explanation of what exactly all of this info is in a procedure, we're going to kind of discuss some of the different details of those procedures. So of course it should have a title, and then the title clearly states what the procedure is for. And so your title of your document is going to be like a quick reference. So if you're doing a urine dipstick or multi-stick test, it would clearly state your analysis procedure or whatever is specific for that laboratory. It also includes the intended use, and so this tells what that particular reagent or test kit is used for. So maybe it's a urine HCG and it's used for the detection of the HCG hormone within a urine sample. The purpose or principle. And so with this in a procedure, you may hear it referred to purpose or principle, but it just simply states why you're doing the procedure. And what it does is it says, what's your intent of this procedure? It gives you a little bit about the theory, if there's any sort of clinical implications to it. So for example, the urine HCG or the urine pregnancy test may tell you a little bit about the background, and that is that particular test method of that particular pregnancy test. What exactly is it looking for and how does it work? So this is usually spelled out in the principle or the purpose of that particular test. And so you'll learn a little bit more about the particular methodologies of tests as you get further into your studies of the different laboratory fields. Reagents and materials, so this is anything that you might need to actually do the procedure. So it should actually state if you're going to need a pipette, if you're going to need a 50 microliter pipette, or if you're going to need distilled water or anything like that. So sometimes you may need something like distilled water to reconstitute reagents. So that should be listed and all of your materials and reagents of what you need. Storage and stability. So this would be storage and stability of the kit itself, or the reagents, or the samples. So it should tell you in detail how long a reagent is good for. When does it expire? Does it expire once it's open for after 30 days? And these are things that you would need to, the procedure itself would tell you to modify the expiration date, or if a kit is to be stored at room temperature, or maybe it's something that's kept refrigerated, but then you bring it out to room temperature, but once it's at room temperature, it's only good for 10 days. So these are all things listed within that procedure for your storage and stability requirements. Sample or specimen, so this will tell you what your sample is, how long is it good for. So sometimes you may have a test where if you draw the sample, it has to be collected and immediately put on ice, and then once it's collected, it's only good for 30 minutes. The test has to be ran within 30 minutes. So these are all things that are in the sample specimen requirements. It'll tell you things that would be rejected. So if the specimen come in, let's say for example it was a COVID test swab, and your particular procedure says that if there's visible blood and mucus, then you have to reject that swab. Warnings and precautions. Anything that could be hazardous or safety precautions should be listed. If you have an accidental exposure, what do you do? And so if you do have an accidental exposure, a lot of your reagents for your analyzers will have an SDS sheet with it. And so with this SDS sheet, it's going to explain to you how to treat if you get splashed in the eye with that particular reagent. So there are a variety of things that are listed in that, and you'll discuss those in a little bit more detail in your safety lecture. Quality control procedures. So this is anything that's included in that quality control parameter, which include calibration, QC, or quality control. This could include quality control of the reagents, the analyzer, anything in that process of interpreting and reporting out those results to make sure that they're done properly. Procedural instructions. So this is the actual step-by-step order of how to perform the test. So if you were doing a urine pregnancy test, then it would tell you step by step: open the package, place it on a flat level surface, use a dropper to drop 4 drops of urine sample into the reaction well, set a timer for 15 minutes. So it's going to be step-by-step instructions. After 15 minutes, interpret this test. And then it may refer you back to how to interpret the test. Interpreting the test would be result interpretation. So this will give you a detailed description of what you're looking for that test. So it could be a qualitative test, which is a positive or negative, or it could be a qualitative test where you get variations of positive. So it could be in a certain parameter, like a low positive, high positive. Usually that's done by some sort of dilution method. And it could be a quantitative test, which is a value. So the interpretation of results will tell you anything that can interfere with the interpretation of results, what to do if you get something that you're not expecting, an invalid result. So in other words, an invalid result may be a urine pregnancy test in which the control line didn't appear. Expected results or reference range. And so this would be where you would list what you expect. So an HCG, urine HCG, you expect someone to be negative unless they're pregnant. Or there could be some other limitations to that test. So with an HCG, could be pregnant. However, there are certain diseases that can cause a false positive test, or there could be certain things that could cause a false negative test. So these should all be laid out within your limitations. Also within your expected results, you should have listed what to do if something is considered a critical value. How do you report that? Performance characteristics would include things like what's the highest detection level for this test? What's the lowest detection level for this test? So most of your urine HCG pregnancy kits will detect from 20 to 25. That's the lowest level. So it could be positive that you would get a negative result. Someone could be pregnant, however, it's not reached that detectable limit yet. So that's why with pregnancy tests, they say if you think that the patient is pregnant, confirmed by another method, like a quantitative test where you actually get a number, or it may tell you wait 3 days and test again, and that's to give that hormone level time to rise to that detectable level. And then of course you would also list any references that you have for that particular test. Thank you for listening to this lecture.